Hey guys, I'm going to be reading pages 192 through 195 of your informational text packet. I'm going to save the questions for when we have our live stream tomorrow, Wednesday from 6 to 7. And then I'll post a video on Thursday of a reading and going over the questions on or through the rest of the packet, so that if you guys have any questions, you have all day Thursday and all day Friday to ask questions before you guys head on to spring break. If you are for whatever reason working on the packets over spring break, I will be checking my email at least once a day. So feel free to reach out to me if you have questions. I just might not get back to you as quickly. But we are going to start on page 192. The wonders of medical imaging. Just over 100 years ago, if you had a severe pain in your abdomen, your doctor had just two ways to diagnose your condition. Your doctor could ask you a few questions to see if your symptoms indicated an obvious and familiar illness, such as the stomach flu, or your doctor could do a surgical investigation by cutting open your abdomen. If you had a huge tumor growing in your abdomen, it might have been your good fortune that your doctor had cut you open and could surgically remove the growth. But if all that was ailing you was a stomach virus, the procedure would have been a drastic measure, at best, and at worst could have been life-threatening. Today, fortunately, doctors have a much easier and safer way of seeing inside our bodies to diagnose our ailments. They can use medical imaging technologies. These modern technologies create images of our bones, organs, and tissues without requiring even the smallest cut into our skin. Radiography. It all started with the X-ray. An X-ray is a type of electromagnetic radiation or energy wave. The energy wave produced by a microwave oven is another type of electromagnetic radiation. In 1985, German physicist, Wilhelm Conrad Röntgen discovered X-rays while conducting an experiment related to electrical discharges and gases. Soon after, the X-ray machine, or the technology of radiograph, was invented. Creating an image of the interior of a body part with an X-ray machine is fairly simple. Imagine that a patient comes in with an arm that may be broken. The patient positions his or her arm between the X-ray machine and a piece of special film. The X-ray machine emits X-rays towards the arm and film. The bones, the densest part of the arm, absorbed all or most of the X-rays that hit them. The less dense parts of the arm, such as skin and muscle, as well as the open space that is the break in a broken arm, allow some or most of the X-rays to pass through them. The X-rays that pass through the arm hit the film. These X-rays create black or gray images on the film. The white areas that remain on the film form images of the dense parts of the arm that absorb the X-rays. Maybe a dentist has placed a small card behind your teeth and aimed a large camera hanging from a mechanical arm at your mouth. If so, then you have been X-rayed. If a young child accidentally swallows a coin, button, or small piece of jewelry, guess how a doctor would figure out where it is in the child's body? That's right, the doctor would take an X-ray image of the child's digestive tract. X-ray machines are most often used to identify problems with hard structures, bones and teeth. That is because it is easy to see the break in the bone on an X-ray image. An X-ray image, however, does not give a very detailed picture of the body part. One reason for this is that X-rays cannot distinguish among tissues or cellular material of the same density. So a tumor that happens to have the same density as the tissue that surrounds it will not be identifiable on an X-ray image. However, an X-ray image can reveal if a patient has a tumor if it is of a different density than the surrounding tissue. Ultrasound scanning. Ultrasound scanning was developed in the 1940s and is based on sonar technology. Sonar uses sound waves to detect objects underwater. Sonar was developed and refined between World War I and World War II as means of identifying enemy submarines. Today, ultrasound scanning uses sound waves to create images of the insides of a patient's body. To create an ultrasound scan, a doctor presses a small device back and forth over the area that needs to be examined. The device is called a transducer and it emits sound waves. The sound waves are not audible to humans. The sound waves travel into the body and bounce back when they hit a bone, body fluid, or soft tissue such as a muscle or organ. The transducer receives these signals and transmits them to a computer. As the doctor moves the transducer back and forth, images of different angles of the organ or internal area are depicted on the computer screen. The doctor can also see movement within the body in real time, such as how blood flows through a valve in the heart. This is a very different way of seeing inside the body from other forms of medical imaging, which typically capture a static image. Doctors use ultrasound scanning to diagnose diseases related to internal organs as well as problems with blood flow. Ultrasound scans can also help doctors detect deterioration or damage to muscles and tendons. Computed axial tomography. Computed axial tomography uses X-rays to create an image, but at a much lower dose than the traditional radiography machine. The image created by this type of technology is called a CAT scan. Sometimes it is called a CT, computed tomography scan. CAT scan technology was invented in the 1970s. The name computed in the name of this technology is a big clue to how it works. First, the patient lies down on a table. The table slides into a large round device. An X-ray machine mounted inside the device then emits X-rays as it rotates around the patient. The X-rays that pass through the body are received on the other side of the device. The machine creates thousands of images in a matter of seconds. The images are called slices. A computer then merges or computes these slices into a single, highly detailed image of the area scanned. And unlike a traditional X-ray machine, the image created from a CAT scan does differentiate among tissues of similar density. Doctors use CAT scans to diagnose many different types of conditions, including brain and spinal cord injuries, many different types of cancer, and circulatory and heart problems. Magnetic resonance imaging. Magnetic resonance imaging works in much the same way as CAT scans. The patient lies on a bed and a machine rotates around the patient, taking pictures. However, an MRI machine does not use X-rays to create the images. Instead, an MRI machine uses a powerful magnet to move atoms in the patient's body. This movement is not visible to the human eye and is so slight that the patient does not feel anything during the procedure. But when the atoms move, they give off radio waves. The radio waves are measured, and a computer translates the measurements into an image. MRIs show an even higher level of contrast than CAT scans among tissues that are only slightly different in density. Some people think an MRI is always the better choice over a CAT scan. However, CAT scans are much quicker to administer. So if a doctor has only minutes to evaluate a brain injury in the emergency room, he or she will likely order a CAT scan. Molecular imaging. Molecular imaging, developed in the 1990s, is an amazing advancement in the field of medical imaging. This type of imaging allows a doctor to see a part of the patient's body at the cellular and even the molecular level. The first step in creating a molecular image is to have the patient swallow a radioactive material. The material can also be injected into the patient, but don't worry, the material has a very low level of radioactivity. The material used is different depending on what condition the patient may have. For example, a patient with a thyroid problem would be given one type of radioactive material. A patient with heart disease would be given another type. The material attaches to the organ or cellular area that is to be examined. Then the patient lies down on the table for 30 minutes to an hour while a scanner moves over the patient. The scanner detects emissions from the radioactive material. A computer uses this data to create a highly detailed image of the body part. Molecular imaging is especially useful for detecting tumors and other abnormal cellular growth. This type of imaging can also reveal whether an organ is diseased or not functioning properly. That is because the radioactive material will adhere to and emit radiation from an unhealthy organ differently than it would from a healthy organ. Future images. It is hard to imagine how medical imaging will advance over the next 100 years, but it is likely that scientists will invent technology that allows us to create even clearer pictures that focus on even smaller areas and provide even greater information. And just as we do, the people of the future will have the X-ray to thank for these advancements. So that's the page or end of page 195. If you guys do end up having questions or can't make it to the live stream tomorrow, feel free to email me, message in Google Hangouts, comment on the video, do whatever works best for you guys. And then I will be posting another video Thursday that wraps up this packet. So really, you guys could be done with all your ELA stuff by Thursday. But if you have any questions, please let me know. And I hopefully will see you guys tomorrow.